football as well.
Are we good, Carrie? She said not yet. Okay, now we're good and we're up and running. Welcome, everybody. Today is Thursday, March 5th. Time continues to fly. This is the Health Facilities Subcommittee, and welcome, everybody. We're going to work on two bills today, HB 965 and HB 1002. I think we're going to actually start with HB 1002. And my guess is we will only have discussion on HB 965 because of some amendments that came in late, and we want to provide the Department of Health with the ability to get a little bit more work done on them. So if we could start with HB 1002, and I'll turn it over to Lindsay.
Thank you. This bill specifies that a resident of a nursing facility may not be involuntarily transferred or discharged to a location other than the location identified in a specified notice. Sorry, I'm reading over this, to which the resident will be transferred. It has confirmed that the resident may be transferred to the facility and the facility is prepared to accept the resident. The bill also alters specified requirements for the notice provided to a resident regarding any proposed discharge or transfer, an updated notice of any proposed discharge or transfer, and a post-discharge plan of care. I did circulate amendments from the sponsor on this bill, but someone from the sponsor's office is here, I think, to speak to those amendments, which they are possibly reconsidering, and some additional amendments that they would like the subcommittee to consider.
Yes, hello, everybody. I'm Emily Charlap. I am Delegate Lopez's Chief of Staff. So the amendments that you all see change the, it takes out a section that says a such as section when it says other locations and the location identified in the notice requirement of the subtitle, because it's saying you can't be going to temporary locations, and we said such as hotels, shelters, or other temporary housing. This amendment would have taken that language out. We are reconsidering that. We still like the idea of those specific things being examples as such unnecessary locations that would be incongruent to somebody's care. So we are reconsidering that, and this amendment also changes the notice date. If a notice has been changed, originally we were saying that if a notice is changed, that somebody gets an additional 30 days from the change notice. This amendment would have changed it to 10 days, but after reviewing more of the CMS guidelines, 30 days is part of the CMS guidelines when a notice has been updated or a new notice has been issued. And so we still want to stick to those 30 days because it aligns with federal CMS guidelines about notices and the appeal time and that somebody has once a notice is put out. So those are the amendments that you all saw, and those are the ones that we are reconsidering. So we would not like those to be added to the bill. Should I pause there before I go into other amendments, or should I continue with the second set of amendments?
Can I add one clarification?
Yes.
These amendments also removed from the bill a requirement that the discharge or transfer form include references to the availability of Disability Rights Maryland to assist residents. I believe that was part of their testimony. So that was actually a third component of these amendments that was included. Okay,
that is something that we would like to keep. I'm not exactly sure if it's all in one amendment, how that works, but that is something that we did talk to Disability Rights Maryland to take out. But the long-term care ombudsman's contact information is going to be still in the notice. So we were okay taking out Disability Rights Maryland because they have a capacity issue. So we were okay with that request.
So what are the other amendments you want us to consider?
So in testimony, Maryland Legal Aid testified that they wanted some clarifying language in the section that outlines a new notice. Originally, it said an updated notice, and they wanted that changed to a new notice, and to include that the appeals rights should be attached to the new notice. When a notice is updated, all of the same requirements still apply. This was clarifying for them because they wanted to make sure that an updated notice still had the same requirements of having the appeals rights attached. And so they thought it was clarifying to say updated is saying new instead of updated, and then to reiterate that the appeals rights would be attached. That is clarifying language. It doesn't necessarily change. The requirements are still the same either way. It just reiterates that any updated notice still has the same requirements as an original notice. And that was for litigation purposes, that they thought that the clarification might be helpful.
That's the only other one that you're considering?
Yeah.
Okay. Any questions, concerns, comments, clarifications?
Yes, Madam Chair.
Go ahead, Delegate Kaufman.
I think that this is a wonderful bill, because I think being discharged from a nursing home or assisted living facility is very traumatic for families, and this gives them a little bit more time to plan. And I view it as consumer protection legislation, so that they're not, this is a cliche, but it really is what it is. They're not immediately throwing grandma out on the street. And I just think for peace of mind for families and older adults, it's essential that we pass the bill.
Thank you. Delegate Johnson.
Thank you, Madam Chair. And thank you, Emily, because I think the amendments have been well thought out. And I like the parts that you are not okay with in the amendments being in the bill. And I like the parts that you're going to keep in the bill from the amendments. So I'm good with those. Thank you.
Thank you.
Anybody else? Delegate Schlega?
May have missed it, but did you guys address the lifespan questions and put their amendments in?
These are the lifespan amendment, the amendments that you all saw, except for the disability rights section. The change in the reissuing notice time from 30 to 10 days was requested by lifespan, as was the removal of reference to hotels and shelters. So those are the amendments that you saw, and these are the ones that we are asking to resist. Those parts of that section, those are the ones that came from lifespan.
Okay, so they're good with the bill now.
No, they would be good with the bill with those amendments, and those are the amendments that we would like to that we would like not to add.
Oh, okay, thank you.
Sure.
Delegate Alston?
Hello. Okay. This is computer. I was just trying to figure out, why are you all opposed to the amendments that they are requesting? And if you said it already, I may have missed it.
Sure, no problem. For the reissuing of a notice or an update of a notice, it's CMS guidelines that any notice that has a substantial change in it get the additional 30 days of appeal time and review. So the 10 days is not, it's not in compliance with CMS guidelines. And also we want to reiterate that any new notice with like a new location that they go to, they should have the same amount of time to appeal it based on the new information that they have originally. So the fact that a location is updated, it does mean that they now have to reconsider everything that they considered before. So if 30 days were required before, it should be required again. And then the language that they wanted to take out in reference to hotels or shelters as being, or other temporary housing as being not acceptable to discharge a resident to, we wanted to keep those in because we think it references the issues that we're seeing through the long-term care ombudsman, and legal aid is seeing residents being sent to hotels or shelters that don't have facilities for their medication. They're not a 24-hour location. And so for the health and safety of the residents, we wanted to reiterate that hotels, shelters, or temporary locations would not be acceptable. In addition, this bill updates that the notice, that the location in the notice that a person is going to be discharged to, the receiving facility, has to approve that that person is going to be coming to them. And also there's an additional 7 days outside of the 30-day notice that the receiving facility has to find a bed for them. Now, what happens to those residents in 7 days? In those 7 days is that they stay at their current facility, but they can't be sent to a temporary location like a shelter because we believe that that is unsafe and not viable for their continued health.
You good? Okay, thank you, Delegate Alston. Emily, first of all, is anybody on from Lifespan that might have a comment?
Folks, I'm with Lifespan, and if I may be heard, I did have some thoughts on the bill.
Please feel free.
Hi, and I apologize. I'm getting over bronchitis, so my voice is a little off. But I want to thank all of you for the opportunity to be briefly heard on this bill. And just by way of brief introduction, I'm an attorney. I work with Bodie Law in Lutherville, Maryland, and I've concentrated my law practice for many, many years in the representation of skilled nursing providers in the involuntary discharge process. I've actually done a lot of training for Lifespan and providers on the nuts and bolts of the state and federal involuntary discharge statutes. It's sort of a area of practice that I concentrate heavily in. So I I am involved in the weeds of many, many of these cases, so to speak. And if I may, I do have concerns about the changes to the bill. And I think I would certainly speak for Lifespan in reflecting these changes. First and foremost, typically what happens prior to any discharge is that the facility has already gone through a 30-day process where presumably a resident has filed an appeal to a 30-day notice of involuntary discharge letter issued under 19344. What would then happen is either they don't appeal, and at that point, discharge rights attach, or there's an appeal process that goes to the Office of Administrative Hearings. There's typically a mediation where many of these cases are successfully resolved. And I've had the pleasure of working with the ombudsman and the very terrific attorneys at Legal Aid in resolving many of these cases successfully. I do want to say that I fully understand and respect the importance of protecting residents' rights. In every seminar that I've delivered on this, I've emphasized from a moral, ethical, and also legal standpoint the importance of ensuring safe discharges. And I'm well aware that the history of this bill, going back many, many years, arose from really outrageous situations involving facilities discharging people to street corners, storage lockers, just really, really bad stuff that I do not in any way condone. However, I will say that the bulk of the cases that I handle involve situations of either chronic non-payment, where the facility is bearing at times catastrophic financial losses, either through residents' refusal to apply for medical assistance or refusal to pay their income resources as required by law. And typically, when I'm called, they're left with no other choice but to look at a discharge option. But what's more concerning is the cases I handle involving residents whose behavior constitutes a threat to the health and safety of other residents or people. And this is a substantial problem that probably begs for legislative solutions that go beyond this bill that I would be very happy to speak to anyone who's interested down the road. But my concern is when we add 30 days upon 30 days to the appeal process, typically when we're going for the discharge, they've already had at least 30 to 45 days for discharge planning. And I did want to mention too that I've had extensive discussions with the current Maryland long-term care ombudsman, who I believe is on the call, Carrie Craig, who initially was the one that initiated the thoughts on this bill. And we actually worked through some proposed changes that you all had seen reflected. And I can say that my concern is that, let me start with the destination of discharge. And this is definitely an area where there can be concerns. And I would say that if we're going from a skilled nursing facility to a non-skilled nursing facility, I absolutely support the idea of resetting a 30-day window. Okay. I don't know that the law allows for new appeal rights, because typically at that point, they've already gone through the appeal process and had a ruling from an ALJ. No one can be discharged from any nursing home through this process until an order of discharge has been issued from the Office of Administrative Hearings, or if they've simply exhausted their appeal rights through not filing an appeal. Either way, there's ample discharge time. And the new law that went into effect in 2019, after Brian Frosch initiated significant changes to the 30-day notice that followed the NMS debacle, was that they have a 10-day post-discharge care plan meeting. So facilities are required to put together a detailed post-discharge care plan. I've actually helped facilitate templates compliant with the law to make sure that this is done so that the receiving facility can safely accept them. So there are safeguards built into the process before we even get to the time frame where we're looking at a discharge. I can tell you it is very difficult to discharge a resident from a skilled facility if they're not paying. But the problem that we have is that if there's behavior issues, for example, and there's a facility out there that can help them, or if they simply don't qualify for the level of skilled care needed in a facility, let's say they lose their level from Telegen, they're no longer considered in need of nursing services. Believe it or not, there are options, for example, for shelters that have specialized services that can help people find jobs and transitional housing. And we would hate to see those options taken away because in some cases they are the only options. And if an appropriate post-discharge care plan is put in place, those can certainly be safe discharge. Not always, but many times. And so what we had
Mr.
talked
McNally?
about, yes, ma'am.
I'm just, if you could let us know which specific things you want to keep in or keep out, that'd be great.
Absolutely. I
Thanks.
apologize.
No worries.
And if you bear with me, my computer went back to sleep. We would propose to continue to delete the references to the shelter hotel because we would want to at least keep them as options, number one. Number two, we would request that the language for the 30-day reset be limited to just situations where a facility is seeking to transfer a resident from a skilled facility to a non-skilled facility. And we would ask that if the date of transfer needs to be changed, that there be an exception to any reset for the appeal rights. And I'm happy to draft this up. And I had spoken with the ombudsman about this. I believe we had communicated some of these proposed changes, and I'm happy to speak with them further. But we just want to be able to preserve the ability of a facility to discharge a resident as soon as that order has passed and they have the post-discharge care plan in place. We just don't want to have to reset new appeal rights every 30 days. One other very brief practical problem is that many times a facility will identify a location of discharge 45 days before it happens, and then the bed isn't there.
Yep.
And then I would hate to see them have to keep someone for another 30 days, especially if they're a threat to the health and safety of other residents, by having to reset that time frame. I think if let's say a facility says, well, the bed's available in 2 days, I don't think we should have to reset 30 days. But again, I fully support the idea of keeping a 30-day window, as does the ombudsman. If there's a non-lateral change, if that makes sense. And that might require some additional tweaking of the language. We're happy to, Lifespan will propose that. It all happened very quickly.
Sure.
And I didn't get a chance to testify at the previous hearing. So I hope that answers your question, Delegate.
Emily, would you be willing to work with Lifespan and presumably the ombudsman on some of the changes and or discuss the challenge of the CMS regulation? And we'll hold this for that.
I would rather, I mean, it's hard because I'm not the delegate and she didn't get to hear what was just said, but we also don't want to hold this up necessarily. I think that we had this discussion with Lifespan and we've had this discussion with the long-term care ombudsman, and the situations that were just discussed are not exactly what would be changing. Nobody would have another 30 days if there wasn't a bed available. They would have 7 days, and the receiving facility would have 7 days to find a bed for them, as they've agreed to. If any of those things change substantially, the ability to appeal still needs to apply, and it's still in compliance with CMS guidelines. So,
Okay, let me go to see what Delegate Johnson's question or comment is. Delegate Johnson?
Thank you, Madam Chair. Mr. McNally, how would you feel about language that it's the shelters and that piece of it that bothers me? Because we all know all shelters are not created equal. So how would you feel about language that said shelters that provide certain services? As you said, some of them do provide certain services. That doesn't mean all of them do. And all shelters should not be considered equal.
Delegate, thank you for your great question. And it's funny. I think we can get ourselves into a situation where we try to have a one size fits all solution to a problem. And I am conceptually in agreement with the point you're making that it would make sense to limit in many cases when someone's leaving a skilled nursing facility, they're still going to need some degree of more specialized care than, let's say, just an overnight shelter that has no services available. And I certainly think there's merit in discussing that. I will say there are cases where people come in to facilities who are unfortunately homeless or off the street. They might have a medical issue. They're discharged from a hospital. They're made well again, and then they no longer qualify for the services. And folks like that typically could be safely discharged even to a shelter without services, which is why, by the way, the post-discharge care planning process, which is required under the statute, is so important. So I would be willing to discuss that. I guess I'm reluctant, and forgive me, I'm an advocate for facilities, and I've seen just the horrors that can happen when difficult residents are kept in facilities and just cause unbelievable trauma to the
All right.
staff, to the
Thank you.
residents.
Thank you, Mr.
Thank you.
McNally.
Thank you, sir.
I think that we're going to go ahead and hold this until next week, so that we can allow Delegate Lopez and Lifespan to have a little bit, and presumably the Ombudsman as well, to have a little bit more discussion and get some clarity and maybe tweak the language a little bit so we can get to a place of closer consensus. Thank you.
Thank you.
Thank you all for the opportunity to speak on this. I really appreciate it.
Okay, let's move on to House Bill 965. Lindsay?
This bill establishes the Office of Healthcare Quality Stakeholder Advisory Council in the Department of Health, excuse me, to provide feedback to OHCQ from stakeholders regarding maintaining oversight of healthcare facilities and notify the Secretary of Health if OHCQ is reported negligent in providing oversight of healthcare facilities. The bill specifies that MDH must provide staff for the advisory council. Beginning January 1st, 2027, the advisory council must hold virtual public meeting once every 6 months. And by December 1st, 2027, and annually thereafter, the advisory council must report its findings and recommendations to the governor and general assembly. I circulated an amendment, which Delegate Ghazzani mentioned was late coming, and I apologize, from the chair, that was in response to several pieces of testimony that the committee received, which basically was saying that this advisory council was redundant or duplicative with work that the Oversight Committee on Quality of Care in Nursing Homes and Assisted Living Facilities was doing. So what the amendment sought to do was repeal that Oversight Committee and move members and duties from that to this new advisory council, with some tweaks, so to speak, some adjustments in membership. There was also the Oversight Committee had some combined staffing requirements, that the Advisory Council was only staffed by MDH. So the amendment moves some of that combined staffing over to the Advisory Council to give MDH some additional help, and to move that experienced staff, so to speak, on the duties that the Oversight Committee was doing over to the Advisory Council. And then notably, the duties of the Oversight Committee were understandably focused on nursing homes and assisted living facilities, and that all was just straight moved to this Advisory Council without any tweaks to expand it to include hospitals or other facilities, just to keep those sort of exact same requirements that the Oversight Committee had been doing. The amendments also incorporated a requested change for the membership, to remove the representative from the Attorney General's office and replace that with the state long-term care ombudsman or the ombudsman's designee. Not circulated because we received it late this morning was another request from Delegate Warman to add to the advisory council a representative of the Hospice and Palliative Care Network of Maryland, which was also a request from their favorable with amendments testimony on this bill.
Delegate Warman, do you want to share what your thoughts are with regard to these changes?
Yeah, I'm cool with the proposed changes. I did want to note though that there are a couple of the groups that were added are no longer active, such as the healthcare facilities. Apparently that dissolved in 2024, and the United Seniors and Voices for Quality Care no longer have websites. So I don't think they're active anymore. But other than that, I'm completely on board with the changes. Yeah.
Okay. As I mentioned, we're going to hold this so that the Department of Health has an opportunity to look at it and come back with any concerns or modifications that they might be interested in. So I don't necessarily have a lot more conversation, but wanted to open it up to anybody who has questions or concerns or comments with regard to the amendments as they stand currently. Seeing no hands, pretend hands being raised. I'm going to say that we don't have any questions or comments. So we will come back to this next week, and hopefully everything will be as hopefully honky-dory as it seems right now, and we'll go from there. Thank you for your time, everybody. We'll see you next week.
Thank you.